So, Ron, I'm going to take these off. Could you give me a very quick sort of overview of what you'll be talking about today?
Sure. I think the idea is to put the idea of risk in some context. So we look at injection drug use and illicit drug use as putting someone at risk for lower health outcomes and certainly shorter lifespan. And we know there's certain risk behaviors that can lead to HIV or hepatitis C transmission. But I think what we fail to do sometimes is take the next step and look into the overall social networks, or what I'm calling the ecology, to see what are the conditions that create the opportunities for risk. And certainly in my experience, which is pretty much close to 20 years, all in Kingston, but working with a kind of long-term relationships with injection drug users, you really see a lot of the clustering of risk behavior. You see a lot of the ways in which families, neighborhoods contribute to conditions of risk. And I think in our society, we tend to look solely at the individual, and I think we need to take a little more social responsibility. So I'm trying to put a little more context around the risk behavior to see really what are the both personal cognitive conditions that create risk behavior in terms of previous experiences that may lead people to be more likely to initiate injection drug use, but also the social conditions.
I'm surprised that hasn't happened yet, or it's happening because you're doing it. Why do you think that hasn't been looked at?
Well, I think as a society in general, we tend to assign a lot of individual responsibility to our behaviors. We kind of have an autonomistic model, and we see people as rational consumers and responsible for our own choices. And when you start to look at the health data and the health literature, it kind of breaks down, because you don't really choose the family you're born to, you don't really choose the neighborhood you're born into, the time in history you're born to, and you don't control all the environment. And I think the thing I struggle with the most is when I try to kind of convey or express the experience of our street health community is people don't understand the behavior. They think it's just bad choices people are making or lack of responsibility. But when you understand the stories around adverse childhood experiences and trauma and family separation and poverty, and you realize the neighborhoods have a huge impact in terms of creating either opportunities or threats for people. We are social creatures, but we tend to focus most of our I think focus on the individual, and I'm not sure why, but I think we're doing ourselves a disservice.
You know, as someone myself who has gone through the whole rehab program and all that kind of stuff, I'm very upfront about that. You know, the catchphrase is always people, places, and things. So it surprises me that the research hasn't figured out that people, places, and things should probably be something to look at.
I think it's harder to study. It's not as quantitative. The data is probably more difficult to summarize. I think you're looking more along ethnographic lines, and I think you're looking more at cultural studies, and I think that that's just presents a challenge for people.
That's great. I'm just going to have a really quickie question, and that is, how are you going forth with the work you're doing?
We're trying to look at a kind of determinants model. I think there's a dearth in the literature around the role of neighborhood in the built environment and its effect on both mental health and addiction. So we're trying to look at the connection between neighborhoods and drug use.
Great. Thank you so much. These are brief interviews. So I'll come up for your presentation later on. And thank you so much for joining us for a quick chat.
Thank you.